With all the swelling and bruising and deformity, you can tell she has a fractured hip, but we're going to get an x-ray of her. So looking at the x-ray, she has a femoral neck fracture, which means that it's broken in the femur about 1 and 2 inches from where the head of the bone meets the socket. It can cut off the blood circulation to the ball of your hip by tearing up the vessels, but in this case it hasn't, so we need to have her surgery as quick as possible. There are 2 other types of fractures. There's the
Intertrochanteric.
hip fracture and the intracapsular fracture. On the
Intertrochanteric.
hip fracture, it occurs away from the joint and doesn't stop blood flow to the femur. The break may be about 3 to 4 inches away from the joint. On the
Intertrochanteric.
fracture, it affects the ball and the socket position of your hip and can also tear the blood vessel that goes to the ball. So what do we do now? I'm going to get my team to prep her for surgery. So what we're going to do is place a multiple screws across the femoral neck that's fractured. We'll make sure the screws are placed within the central 2/3 of the femoral head to avoid the complications. We have different types of screws, like solid and cannulated, made from either stainless steel or titanium, and when we're in surgery we'll see which is the best screw to use for the hip. We try to aim for central screw placement with the tip of the screw no closer than 5 millimeters to the subchondral bone, which is right below the cartilage of the ribs. 1 screw will be placed along the center of the femoral neck, and 2 other screws placed in the triangular configuration of the front and the back of the femoral neck, and then surgery should be done after that. She will need some medication and physical therapy after this. So the way the skeletal system is structured, it's divided by 2 major regions: the axial skeleton, which consists of the skull, vertebral column, and the ribcage. The other is the appendicular skeleton, which consists of the arms, pectoral girdles, legs, and pelvic girdle. There's 206 bones in the human skeleton. In the skeletal system, there's 4 main functions. The support and protection. It protects the organs and creates structural support for the entire body. There's movement, which is the bones function as levels of the muscles to provide movement of the body. And there's hemophobiasis. Forms elements of the blood that produce red marrow of the bones. And then we have storage of mineral and energy reserves, which the bones provide an important reserve supply of calcium and phosphate. Also store lipids, which are an energy reserve in yellow marrow. In the immune system, the body's defense against infectious organisms and other invaders. In this case, with the fracture, a blood clot is created in a couple of hours. Inside the blood clot, there's special cells called phagocytes, and they begin to clean in the bones fragments and kills germs which might get around the break. Then a soft callus made mostly of collagen is created around fracture by another special group of cells called chondroblasts. After a while, a hard callus forms next as osteoblast cells create a new bone. Then lastly, after a while, the bone is remodeled. Special cells called osteoclasts break down extra bone around the fracture until it's completely healed and returned to its original shape. This will all take time, like years. There are health risks with this surgery. I don't want to leave that out. It will leave you with an impaired ability to walk for a period of time, but that's what the physical therapy is for. She needs to be very careful after the surgery because after the first broken bone, there's much greater risk for another, which she also has osteoarthritis, which is degeneration as in loss of joint cartilage and the underlying bone. With all that, we need to talk about how it's going to affect her living. So having a hip fracture can shorten your life. It can reduce your independence because having a fracture can lead to another fracture. 3 out of 10 people die from a hip fracture. Staying with someone or someone is staying with you is the best idea. With all that being said, you have options of long-term care. There's a nursing home because the person needs to be assisted. So either that or move in with your family members because she does need help and attention. So I have to go get ready for surgery, but I'll be back with more information. So we're done with the surgery and everything is great. Grandma's back in her room asleep. I want to mention that recovery is not to be told because it all depends on how the person uses their physical therapy. but I will tell you that it can take about a year or sometimes less, sometimes even more. We'll do a monthly checkup to keep up with her.
Thank you, Dr. Canales.
Hey, I'm just calling to let you know